to have severe claustrophobia, and along with the claustrophobia comes a panic attack.
That was the voice of a wheelchair-bound Montreal woman suffering from MS. She contacted City News with her story and wishes to remain anonymous. She says different medical reasons prevent her from wearing a mask, but when she came here to the Brunswick Medical Center in NDG, she says she was refused treatment because she wasn't wearing one.
I said, you really need to put it on, put it behind your ears. This is the only way that I can take you in. He says, if not, he says, I have to refuse you.
If he or she refuses to treat the patient, he or she cannot let down the patient. According to his own deontology code, he has to refer the patient.
The woman was told she could get a phone consultation next month and walked away from getting a treatment that helps her mobility, as Quebec makes masks mandatory in indoor public spaces as of July 18th. The woman says the clinic wasn't making any exceptions.
We follow the guidelines from Collège des Médecins. She says, and you have to wear a mask.
We reached out to Brunswick Medical Center, but they didn't get back to us in time for air. The College of Quebec doctors told City News they're not commenting on this right now as they're currently reflecting on the subject. Meanwhile, Ewan Sauves of Premier Legault's office says we are aware that some people suffer from special medical conditions that prevent them from wearing a mask. Consequently, these people are not affected by this obligation. It is not mandatory for affected people to obtain a medical certificate to be exempt from wearing a mask. We trust people's good judgment. And it's not just medical appointments. The handicapped woman says she's worried about being left behind. She relies heavily on adapted transport. Isabelle Tremblay, a public affairs officer with the STM, says it's the client of adapted transport that has the responsibility to communicate with us the reasons they can't wear a face covering.
So tomorrow I have another appointment. That's why I called Transport Adapté, and I was told that, they can't put an exception in my file, and when the driver comes, he has the right to refuse to take me in the van.
That needs to be fixed because if you have to go see your doctor, you have to be able to go. So adapted transport is a necessity. So yes, they do have to settle that.
Stephen believes the Public Transit Authority will start making exceptions soon, especially with valid medical notes on file. But for the woman, the idea of not knowing if she won't be refused treatment again or transport in the future is nerve-wracking.
I'm waiting at home patiently. It's just that it's starting to affect me a little more because of my appointments that are coming up. I'm trying to resume life, but it has become harder.
In Montreal, Alicia Rubertucci, City News.